I'm Kyle Schneweis. I'm board certified in family and sports medicine, and I practice at the Liberty Clinic. A concussion is a transient functional disruption in the brain from a head injury. There are three main things that define a concussion. It's temporary, it's a disturbance in how the brain works, and there's no anatomic changes that can be noted in the brain on imaging. A common question I get is, how do I recognize a concussion? The symptoms of concussion can be loosely broken into three major categories. One is sort of migraine headache-like with sensitivity to light, sensitivity to sound, headache, as well as cognitive, mental slowing. Patients will talk about feeling slow or having trouble with word finding. And then emotional, where generally patients will be overly emotional after the head injury. One of the common questions I get is how to recognize when someone may have a concussion and needs evaluation, given there are numerous head injuries that don't result in concussion. And I think the easiest way to tell you is just give an example of how we handle it on the sidelines of a football game. So a guy gets hit, we're all concerned, and generally we'll give him until the beginning of the next play, so the play clock. He's got 20-30 seconds for dizziness to resolve, any sort of confusion to resolve. Essentially, by the time the next play is going to start, the only thing he's really allowed to have is a headache. Most children with a concussion do not need any imaging. What they need is to be evaluated by someone who's trained in evaluating concussions, and that evaluation period may take 30 minutes to several hours, because by definition, concussion is sort of evolving, and we'll see symptoms develop over time. There are numerous ways that have been shown to prevent concussions. None of them involve hardware, okay? So we know if we change the rules of football and we limit kickoffs, we get less concussions. We know if there's less contact, there's less concussions. We know if we teach kids to tackle appropriately, there's less concussions. But there is no helmet or device or pad or cap that has ever been shown to reduce the incidence of concussion. A solid helmet certainly has good evidence for preventing skull fractures, lacerations, missing teeth, but has zero evidence for preventing concussions. If you have any doubt that it might be a concussion, sit the kid out.